A very good evening. The paper topic is impact of mid-level ophthalmic personnel at Vision Center associated with tertiary eye care hospital, mainly with respect to glaucoma screening. A brief about methodology. In this study, a retrospective case review was done on all referrals received at our tertiary eye care center from MLOPs at 13 associated vision centers. Who a mid-level ophthalmic person is and the concept of vision center will be discussed in the subsequent slides. MLOP performs ophthalmic evaluation of patients, which includes anterior chamber depth assessment, intraocular pressure measurement using Goldmann applanation tonometer, and a dilated indirect fundoscopy to look for suspicious optic disc. A patient with intraocular pressure of more than 21 mm of mercury, or a shallow anterior chamber with Van Her grading of less than 2, or a suspicious optic disc are discussed about with the general ophthalmologist in the virtual clinic. Patient in need for further evaluation are referred to the base hospital with a referral letter containing the patient particulars. These referred cases are then evaluated by a glaucoma consultant at the base hospital. Purpose of this study is to discuss quality of these referrals from the MLOP retrospectively and to look for degree of agreement. This study can be weighed on the following headings. First one, coming to glaucoma. We won't be discussing about the glaucoma as a disease as such, but those aspects of glaucoma which requires pertaining to this study. Glaucoma is the leading cause of irreversible blindness worldwide. It is more likely to be prevalent in the advancing age. Screening for glaucoma is difficult. Deteriorating vision or other symptoms are the most common reason why people seek an eye examination, which may work against the early diagnosis of glaucoma. Early detection and timely treatment are important. Coming to glaucoma prevalence. Prevalence of glaucoma in India can be ascertained from following studies. These studies found that prevalence of POAG was 1.5 to 2%. Prevalence of angle closure was 2.5 to 8%. They also found prevalence of glaucoma to be more with advancing age. This is mainly with respect to rural population. So having considered these factors concerning glaucoma, it necessitates development of methodology for developing methodology for opportunistic glaucoma screening. This study is an attempt towards the same. The next topic would be study question. Why this method of screening? Why evaluation of such screening method is required? According to UK National Screening Committee, screening for glaucoma is difficult. One of the most widely accepted method to detect glaucoma is to perform comprehensive eye examination irrespective of the patient complaints. Royal College of Ophthalmologists ascertained that any formal screening program will not identify every subtle glaucoma at a stage at which glaucoma specialists can. This study, which is first of its kind, evaluating the effectiveness of MLOPs in opportunistic screening for glaucoma, addresses two of the above mentioned issues. That is, assessment of glaucoma during comprehensive eye examination, which is done by MLOP at vision centers. Referral to glaucoma specialists to identify subtle glaucoma at an early stage, which is done at the base hospital. Avoidable vision impairment will not be eliminated by 2020 using just the current global eye workforce, while increasing the number and skill of ophthalmologists should be the priority. This is not sufficient to overcome the need for increased human resources. So, emphasis has to be shifted away from hospital-based acute care with ophthalmologists at the peak of the helm and nurses playing the most ancillary roles. This concept has been crystallized as one of the key strategies underpinning Vision 2020, the right to sight. Primary eye care by MLOP at Vision Center may act as an important source of glaucoma referrals. To the best of our knowledge, this is the first study on opportunistic glaucoma screening for rural population in southern India. Result of this study can be utilized to evaluate which aspect of glaucoma screening by MLOP needs to be addressed, may increase the quality of referral and indicate room for improvement in MLOP training. May also be useful in setting up guidelines for glaucoma screening by mid-level ophthalmic personnel. Coming to mid-level ophthalmic personnel. Definition. The most recent and comprehensive definition of MLOP specifies their workplace, whether facility-based or on outreach, based on their training. That is, they are not doctors, they do not provide health services other than eye care, and they provide eye care service on a full-time basis. This is the structure of 2-year training program the MLOPs undergo at our institute. They are trained in various aspects of ophthalmology. Coming to the Vision Center. Vision Center is a small permanent facility set up to extend eye care services delivery to remote and rural communities with the objective of increasing the uptake of comprehensive primary eye care. Arvind's Vision Center allow patients in the rural area to be remotely diagnosed by ophthalmologists at the base of the hospital via high-speed wireless video conferencing. Arvind Eye Care has established more than 40 vision centers in various districts of Tamil Nadu. These are the locations of the various vision centers associated with our center. Each vision center caters to the population of 45 to 50,000. Coming to the results of the study, our tertiary eye care center and their associated 13 vision centers received a total of 342 referrals during the study period of 2016. Of the 342 cases, 12 cases were found to have insufficient documentation in the referral letter, or they were normal cases with referred in view of positive family history, and 73 cases were cases of diagnosed glaucoma and were referred for scheduled follow-up. So these cases were excluded, and the remainder of 257 cases were further evaluated. Of the three referral parameters, a shallow anterior chamber with Van Eyck grading of less than 2 was the most common cause for referral, accounting to 48%. We received a total of 124 cases with the shallow anterior chamber, of which on evaluation at the base hospital, 23 were found to have open angles on gonioscopy. Remainder of the patients, 101 patients were found to have occludable angles, and they were further evaluated. Suspicious optic disc was the cause for referral in 34% of the cases. It is total 87 cases were received with suspicious optic disc, out of which 26 on evaluation at base hospital was found to have normal optic nerve head. Raised IOP was the cause for referral in 18% of the cases. That is, we received a total of 46 patients, of which 35 cases on evaluation at base hospital were found to have a normal IOP. Coming to the final outcome, of the 257 referrals we received, 49 patients were discharged as normal cases, resulting in accounting to a false positive rate of 19%. 166 patients required intervention either in the form of initiation of anti-glaucoma medication, a laser peripheral iridotomy, or a surgery, while 42 cases required monitoring with regular follow-up. Among all the referral cases, most common diagnosis was that of primary angle closure suspect and a primary open angle suspect, with PACS being the most common diagnosis. Followed by 19% of the cases were were discharged, which were normal cases, had a diagnosis of immature cataract or a presbyopia refractive error. 19% false positive rate in our study, when compared with the related studies, it was found to be lower. Most of these comparison studies were from the European nations. No study from India is available for cross-referencing. To conclude, MLOPs are a highly skilled group of professionals whose ophthalmic examination skill could be utilized to provide shared glaucoma care. Early diagnosis improves patient quality of life and elevates pressure on secondary eye care. This study represents one possible configuration for glaucoma case finding. Thank you.